Hi, everyone. Welcome to the 12th webinar of our month-long series in honor of Lymphedema Awareness Month. Today, we're really pleased to welcome InBody, MediUSA, and ImpediMed to present some of the technology that is available for lymphedema. But before we get started with that, I'd like to introduce my team to you. So if my team can please go ahead and share your video and share your mic if you'd like to say something. Otherwise, at least your video. On the upper left, you see Alyssa Fiorito. She is the NLN Garment Program Manager. On the lower left, you see Veronica Senares. She is our social media manager. And in a parking lot somewhere is Jennifer Williams. She is our continuing education manager. And also on our team, which they aren't able to present their videos right now, are Christy Blair. She's our project manager. Erin Sokolsky, she's our marketing manager, and Nicole Ballard, who is our membership manager. Thank you to the entire team. Oh, and there's Christy Blair. Thank you so much, Christy. Okay, cool. So, please make sure that you stick around until the end because we'll be giving away 3 more NLN memberships, supporter level. And for that, you get a conference registration discount, access to our membership platform, access to our video library, and other great things. Oh, yes, of course, you can participate in our group chat discussions, which are for members only. So with that, I'd like to now, well, actually it's unrelated. So delete that. Break, and here we go. Allow me to introduce Charlene Gamis. She is with InBody, and she'll be presenting on the InBody technology. So Charlene, thank you so much for being here with us, and we're looking forward to your presentation. And then also, just so that you know, in the chat room will also be another member of the InBody team. That's Deborah M, and she will be responding to any questions that might be coming up or commenting anything that might be coming up in the chat. At the end of Charlene's presentation, I'll be asking Charlene the questions directly, the ones that come into the Q&A box. So thank you so much, and Charlene, welcome.
Thanks so much, Jeanette. And hi, everyone. As Jeanette mentioned, my name is Charlene, and I'm with the clinical research team here at InBody. And very happy to be here and to be able to share more about the InBody with you. I will be covering InBody bioimpedance technology and how it is used in health assessments. So what is InBody? It is an advanced bioimpedance device that sends a safe, low-level electrical current throughout the body. Based on the resistance to this current from the body's tissues, it determines the amount of water, lean, and fat mass in the body. Pictured here is our InBody 770, which is the model most widely used with lymphedema patients. Now, as a global leader in body composition analysis, InBody utilizes 4 key technologies that set us apart from other bioimpedance devices. These include multi-frequency measurement from 1 kilohertz to 1 megahertz to distinguish intracellular and extracellular fluid compartments. Intracellular water is the water within the tissue cells, and extracellular water includes the interstitial fluids, blood, as well as lymph. Together, they do comprise total body water. A built-in 8-point tactile electrode system with thumb and heel electrodes for 99% reproducibility, as this results in consistent starting point of measurement. Our patented direct segmental measurement of the trunk and limbs to identify imbalances, and complete measurement without empirical assumptions based on age or sex for truly personalized measures. Together, these technologies improve accuracy, reproducibility, and provide deeper value to your body composition analysis. InBody total body water measures have been validated to the gold standard D2O dilution method and to a number of methodologies in various populations. Most recently, we have been validated by Mayo Clinic and Cincinnati Children's, which found high correlations for fat-free mass and fat mass in adults as well as children compared to DEXA. In fact, InBody is the only BIA device to be validated by Mayo Clinic at 98% to IDEXA. So it's accurate and validated, but also easy to use. Here's how to test. So you can see it's as easy as wiping hands and feet, standing on the device, and pressing enter. The comprehensive in-body report includes 2 pages. The body water report is used to monitor fluid status. As you can see here, it includes reference ranges for intracellular, extracellular, and total body water. The down arrow indicates below the healthy range. The dash refers to the healthy range, and the up arrow indicates a value above the healthy range. Each of these references compares the user to someone of their same height as well as sex. More importantly, these values are reported for each segment as well. The segmental ECW to TBW analysis shows the ratio of extracellular to total body water, or ECW ratio, which is an indicator of fluid balance in each limb and the trunk. In this section, the bottom dash refers to the healthy range. The single up arrow indicates mild edema, and moderate to severe edema is indicated by a double arrow pointing up. We can also see the segmental values for both intracellular and extracellular water, or ICW and ECW, in the upper right-hand corner. These can be used to assess compartmental water changes and their effect on segmental ECW ratios. Another valuable output is whole body and segmental phase angle, which reflects cellular health and are a sensitive indicator for changes in health status. These segmental measures are obtained, as mentioned earlier, through our patented direct segmental measurement technology. In the bottom right corner of each report, all impedance measurements for each limb as well as the trunk are displayed. Not only can this section be used to verify separate measurement of each segment, the ratio of impedance between limbs as an indicator of fluid imbalances in lymphedema patients has also been supported through research, which we'll cover later in the presentation. Next, the body composition report focuses on lean, muscle, and fat mass. Here is where you can become more aware of your muscle fat analysis to assess nutritional status. Connecting the ends of the graphs in this section results in a C shape, which reflects a higher proportion of fat to muscle. A more balanced shape would be an I or a D shape, indicating a greater proportion of muscle compared to fat. Below this, the segmental lean analysis reports the amount of lean mass in each segment, as well as its sufficiency to support your current weight. This can be assessed along with the ECW ratios on the side to help identify any imbalances, whether between left or right sides or upper and lower parts of the body. In the top right corner, visceral fat area, an important metabolic health indicator, is reported for a more in-depth assessment of fat distribution. For both pages, the right-hand side of the report is customizable. Feel free to speak with your physician about selecting the outputs needed most in your care and health assessment. Now that we've covered the key parameters, let's take a look at some sample reports. In this example, the individual's baseline test revealed an elevated ECW ratio of 0.409 in the left arm. For reference, the healthy range is 0.36 to 0.39. With proper management, the ratio was reduced to 0.399. Throughout your treatment, a more granular approach can be taken by monitoring segmental intracellular and extracellular water. For example, muscle loss will be shown by a decrease in segmental ICW, while a reduction in fluid retention will lower segmental ECW. In short, muscle loss or increased fluid retention will drive the ECW ratio up, while muscle gain or reduced fluid retention will drive it down towards the healthy range. Phase angle reflects the structural integrity or the strength of the cell membrane and is inversely related to ECW ratio. The higher the better, with the healthy range for males being 5 to 7 degrees and females 4 to 6. This example shows a whole body phase angle of 4.8 degrees, which is within the healthy range of 4 to 6 for females. However, the lower phase angle on the left arm, when compared to the right, points to the increased left arm ECW ratio. So phase angle can also be monitored over time as a sensitive indicator of changes in health status. On the body composition report, we can identify nutritional status based on the muscle fat analysis. This individual falls within the healthy ranges in terms of weight, skeletal muscle mass, and body fat mass. This should be maintained as much as possible, or skeletal muscle mass can always be improved to promote better health and mobility. In the segmental lean analysis, you can also reference the ECW ratios for each segment on the side. Overall, this individual has well-developed lean mass throughout the body. The lower body is just slightly lower proportionally, so this can be maintained or increased through targeted exercises to improve that balance. Taking a closer look at visceral fat area, this individual is well within the healthy range for her age, indicated by the gray shaded region in the graph. When fluid is stable, visceral fat area should be monitored as an important indicator of fat distribution and metabolic health. Let's say this is your result sheet. We can see from the report that you have elevated fat mass, percent body fat, and visceral fat area, which can be addressed through lifestyle modifications after speaking with your doctor. In the segmental lean analysis, you'll also notice some imbalances. The right leg lean mass is significantly increased compared to the left, with a very high ECW ratio of 0.408. That being said, ECW ratio is also elevated in the trunk and left leg, which indicates fluid retention throughout the lower body, concentrated in the right leg. This is also reflected in the phase angle, which is 3.9 in the right leg versus 4.9 in the left. As you can see from this result sheet, the comprehensive in-body report provides deeper insight into your individual health status and physiological changes. With continued testing, you will be able to become more aware of differentiating weight and volume changes due to fluid, muscle, and fat mass to better understand your treatment and care with objective measures. A number of research studies have further explored the use of InBody in lymphedema patients as a non-invasive and relatively easy and quick method compared to other methodologies. A study by Mosley and colleagues compared the use of InBody to pyrometry, finding a good correlation in volume changes between the two methods. They determined that the InBody is a more accurate assessment of limb fluid change and that it was equally valid to pyrometry in reflecting leg volume changes and can be used sequentially in both the clinical and research setting. One study found significant ratio differences in patients with lymphedema after ALND compared to those without lymphedema. In another study, water reduction in lower limb lymphedema was demonstrated by in-body assessment, reflecting its ability to track sensitive changes for better interpretation of LVA results. Further research has been published using the InBody and the value of early assessment, intervention, and detection of lymphedema after breast cancer treatment. In a study that implemented InBody in a surveillance program, incidence of irreversible lymphedema was significantly lower in the surveillance group compared to the historical control group. Reference values for breast cancer-related lymphedema have also been published, which found a significant difference between patients with lymphedema and health controls, supporting similar research findings that bioimpedance can be used to assess and rule out lymphedema. More recently, a study published this year found InBody data to correlate with clinical measurement, and due to its sensitivity to subtle changes in lymphedema, it was suggested BIA can be useful for long-term maintenance. For any clinicians in the audience, and also just to showcase the convenience of accessing and viewing data, there are several ways to do so. The tests are searchable and viewable directly from the device. They're automatically printed after each test. They can be accessed through our online LB web portal and through EMR integration. Some additional features and perks. The InBody is a standalone device that can store up to 100,000 tests for serial tracking with no need for monthly fees for data storage. Of course, as shown in the previous slide, the amount of storage is limitless with our Look InBody software, which also allows clinicians to administer the test from a distance. Our instruments are extremely user-friendly, with voice guidance and a convenient cable electrode design, allowing clear separation between the arms and trunk for those segmental measurements, making testing simple, effective, and reliable. The InBody is not only a complete, ready-to-test system out of the box, we also provide an online training portal, unlimited product support, and clinical research resources. In regards to medical billing, we are happy to share with clinicians upon request. To that end, with the shift to value-based care, InBody provides quick, non-invasive, point-of-care health assessments for you as you test on our devices. These objective measures of segmental water, muscle, and fat can better inform and help you understand clinical decisions made by your provider. It can also help with communication, education, and enable your physician to provide tailored therapies based on your own individual body composition. That is to say, InBody allows for personalized assessments for personalized medicine. If you are interested in taking an InBody test, we make it easy for you. We worked with our partners here in the US to come up with a locator map. Please visit the locations tab on our website, inbodyusa.com. You can simply type in your zip code and you will be able to find and contact the nearest InBody 770 testing location. Thanks everyone so much for your time, and I'd be happy to answer any questions.
Thank you so much, Charlene. You know, I think it was really comprehensive, and some of the language might be more complex because it's like very medical in terms of the terminology. So, I think that I have a couple of questions, and perhaps it'll be able to make it a little bit easier for some patients who are not in the clinical arena to understand. So, for example, one of the questions I have is, is this a device where it will be sensitive to like changes like from day to day? And is there like a range, or not a range, but is there a limit? Like, can you do it 2 times a day, 3 times a day, or can you do it every day? And again, like, will it pick up those changes from that short interval of time?
Sure. Yeah, so that's a great question, Jeanette, and something that we do get quite often. In regards to the testing frequency, you're more than welcome to test, every day. We do recommend at least, 2 to 4 weeks, just to allow for any changes to occur. But that's not to say that you can't test, daily. We are a very sensitive device. Again, we do use multiple frequencies from 1 kilohertz to 1 megahertz, as well as that direct segmental measurement of each of the limbs as well as the trunk. So we do monitor those sensitive fluid changes, especially for people who are, someone who might be experiencing lymphedema, where they'd want to track those sensitive changes over time.
Thank you. And then when somebody gets a reading, and let's just say there is somebody who has, let's say, a risk for lymphedema, and let's say the right arm. And so they get this reading, and then it says the percentage of water, in that arm. Is that number correlated to like a definitive cutoff point in terms of diagnosis of lymphedema, or is this just another tool for the clinician to use amongst their other clinical skills like assessment, inspection, and everything to make a diagnosis of lymphedema?
Right. So we are an adjunct tool that can be used as a resource for clinicians. We wouldn't say that InBody itself can diagnose or specifically treat any disease, but we have seen clinicians use this as an adjunct tool in terms of monitoring and tracking any changes and the progress of their patient's condition and health status. And I'm sorry, the first question you asked was in regards to where they could see the...
Oh, I think you answered it. It was just a matter of the amount of percentage or the percentage of water in any given limb, let's say, and that's the limb at
Mhm.
risk. Again, is there a cutoff point that kind of like says, okay, if it's beyond this, you probably have lymphedema, or if it's below this, you probably don't. You know,
Right.
yeah.
Yeah, and we do actually have some impedance ratios that we've seen in research as cutoffs. If anyone does want that type of information, feel free to email inquiries@inbody.com and I can provide them with that data. Or Jeanette, if you would like me to provide that data to you to share with attendees, I can do that as well.
Yeah, I think that just might be interesting, and we can put
Mhm.
it up on our website for everybody to see as they watch the recording of this video.
Sure.
Thank you. And you posted like a directory of where we can find an
Mhm.
in-body machine. Now, are all of those such that we can just walk in and say, "Hey, I'd like a reading today"?
Right. So it would depend on the facility. They do provide the contact information for each facility on there. So I recommend if you are going to walk in there, feel free to call them first, especially right now in light of COVID and the pandemic. I'm not too sure if all the facilities would currently be open or be accepting walk-ins. They might want you to reserve in advance just to make sure that they are available to provide you with that test. Um, and then real quick, Jeanette, just to follow up in regards to the lymphedema cutoffs that you had mentioned, I also wanted to mention with our ECW ratios, we are looking at zero point 0.4, above 0.400 would be a sign of someone with, moderate to severe edema.
Okay. Thank you so much. And is there anything else that you'd like to add to our patient community?
So we do have additional resources available on our website if they would like. We have customer case studies, a page showing how lymphedema is applicable to the InBody and any blogs and testimonial videos. But other than that, of course, they can always reach us at inbodyusa.com or they can email us at inquiries@inbody.com.
Thank you. Thank you so much, Charlene. And thank you, Deborah, for monitoring the chat. Something that I have to say, even though it is like such a cool machine, the National Lymphedema Network does not endorse any product or any service from any of our sponsors. We're just here to connect them to you so that you can learn about the available options as it relates to treatment and just managing your lymphedema. So that's an important disclaimer. But Charlene, thank you so much for your time.
Thank you, Jeanette, and thank you everyone for attending.
Thank you. Okay, so what I'd like to do now is actually to take a moment because, Vanessa, who made this great recommendation in terms of using Wheel of Names when we are giving giveaways, and we're going to be giving out NLN memberships at the end. So if you are interested in entering that drawing, if you can just raise your hand before I introduce you to Christopher, so that way we can start to put your names into the wheel, and then we'll pick everybody at the end. So with that, it is now my pleasure to welcome Christopher Miles from MediUSA, who will be sharing with us the technology that they have, which is known as MediVision, and it's available for, well, he'll tell you all about it. Christopher, welcome.
Hey, thank you so much, Jeanette. I'm super excited to be here and to share a little additional information about MediVision. So I myself work for MediUSA. I am part of the clinical education team. We probably work with a lot of your therapists who are working with you in the clinic to help broaden their understanding and their knowledge in choosing the right compression for you to be successful once you are fully decongested and get discharged from your lymphedema clinic. So what's most important is that you and your clinician can work together to find out the solution that's going to be effective for you to keep that lymphedema under control and prevent it from moving forward. So I'm sort of the compression guy. I work for a compression company. And if you are familiar with compression, you understand that there are multiple different types of compression that are out there. For early stage lymphedema, it's very likely that you may be able to go into a compression sleeve or a compression sock or knee high or thigh high or waist high, a product that is what we call ready to wear. So it's something that fits within a size range. So if your limb is still fairly normal shaped, then you can go into a ready to wear product. and it doesn't need to be custom made for you. But as your lymphedema advances, you may not fit into a normal shape sleeve or garment. And at that point, you have to go into a custom garment. So this would be a custom garment because you don't fit in the size range, or if your lymphedema is so persistent that the typical entry-level garments just are not adequate enough in containing your edema. So this would be going into a custom garment, and the custom garment is actually made out of a flat knit material. A flat knit material is going to be a little bit, what we say, more stouter, a little bit stronger. So it will help provide the wall on the outside from allowing your limb to swell during the day when you're active. What's most important is we want you up, active, exercising, doing everything you want to do, and wearing a compression solution that will allow you to be independent. So unfortunately, as lymphedema does progress, you're going to have to very likely go into, if your edema does progress, you're going to have to go into a custom garment. And this is sort of my segue into the technology that I'm going to be talking about today, because the ability to create a custom garment is a little bit more involved than taking a couple tape measures. So at the beginning, if you can go into a very simple garment, your clinician or your fitter at the compression store, maybe where you've gone and got some compression, they take a couple measurements around your limb and they pull product out of the box, and it works. And that's fantastic. And I hope that works for a lot of folks. But for those folks that have to go into more custom garments, you may have already gone through the process of this. It's a lot more involved because the garment actually will need to be made for you. So the therapist or the fitter is going to take out their tape measure. They're going to probably mark up your arm or mark up your leg to make sure that they're taking the right measurements. And then they're going to fill out a form to create the garment. The garments are actually created over in Europe, over in Germany. That's where the knitting machines are. And then they come back. And when your therapist or your fitter has to use their tape measure and they have to take all these different measurements, sometimes they can take up to 48 to 50 different measurements so that the garment will be made specifically for you, all the way up your limb. Maybe it's a custom glove, maybe it's a custom knee high or thigh high, or even a cap to go down on your toes. And all those measurements are very intricate that need to be taken. So if you're measuring for, let's say, a waist-high garment, you need to take about 48 to 50 different measurements, and then they have this very complicated order form that they need to fill out to be able to customize the solution for you. That takes a lot of time. It's very rote, it's very repetitive. There are opportunities for errors. So this is sort of my segue into MediVision, because with technology today, there's a more of advancement in the ability to capture measurements. So I can say that we have been using tape measures to measure for lymphedema and to measure for compression garments since lymphedema has started, since lymphedema care has started. So just within the last couple of years, we're finally starting to see some advances in technology in capturing those measurements. A couple of years ago, a company called Lymphatech came out, and they basically came out with technology, a 3D technology that can scan your limb and actually capture the measurements automatically without using a tape measure. Very precise, it's clinical evidence, it's studied. So essentially, Medi has partnered up with them, and I'm going to sort of walk you through how we utilize that technology in creating a custom garment. So essentially, MediVision is what we call it. That's our product. And MediVision it's an app. Everything is about apps these days, all the different apps that you have on your phone that do all very specific things for you. So Medi has an app that will actually help measure and help clinicians or fitters order a garment, a custom garment for lymphedema patients. So essentially, MediVision lives on an iPad. Hopefully most people are familiar with an iPad. This is an iPad mini, a little smaller, easy to handle. But on the outside of it, you can actually see, I put an extra 3D camera on the outside, and this is the key. The cameras in iPads and even iPhones aren't quite good enough to capture 3D rendering for medical purposes. the cameras do advance all the time, but for medical consistency and for accuracy, we have to use an external camera. So the MediVision comes on an iPad with a 3D camera that's mounted on the outside, and the devices work together to create the image to go ahead and create the garment. So what I'm going to do now is I'm going to share my screen. I threw together just, it's hard for me to explain without showing you images of how this works. So I am going to share my screen and we'll walk through and I will sort of explain a few things here. All right, very good. So scanning for garments is really cool, really excited. We started with this within the last year. Of course, everyone knows what happened within the last year. So everything has been a little bit slow, but there are a number of devices that are out there scattered across the country and actually scattered around the world. We actually launched this globally. So in the US has been the partner that has been using a lot of MediVision technology to measure for flat knit garments. So we can sort of jump in here. So what you can see here is you can see someone who's holding the iPad and the camera, and then we have a model there who's standing because we're going to go ahead and scan the limb. So when we scan someone, we have to have visibility of the tissue that we want to measure. So if we're measuring for knee high or thigh high, we actually have to see the skin to capture the measurements because we're going to be taking a 3D image of the limb. So what happens is once the patient is standing with the skin visible, with this patient that's standing in the middle, you can see that there's a little bit of a box around the bottom part of her leg. So that is what the technology does, is it identifies what mass it wants to capture, and then it will create a 3D rendering image, which I will show you because I think that's the coolest part. And then the person who is scanning sort of walks around the outside with the MediVision in their hand, and it's sort of like using spray paint. It's sort of walking around and you're sort of spray painting the limb and you're capturing all the outside surfaces of, here they're doing a knee-high garment. So you can see here is a 3D rendering image of someone that we have scanned all the way up to the waist. Okay, so you can see she's standing on the floor segment there, and then you can see an image. And I will show you a 3D image in a second so that you can actually appreciate, and we'll rotate around and we'll look at the image. So the technology using this 3D camera will capture this 3D image. And I talked about Lymphedema that we've partnered with already. So what they do is they measure volume. So when you went to see your lymphedema therapist, they were always taking those measurements going up your limbs, your arms, or your legs, and they were able to identify with the tape measure whether you were progressing and reducing the amount of edema. So Lymphedema launched this technology. They can replace the tape measure for measuring volume. And what they do is they use this information to calculate volume. We capitalize on that data and we use the same data to use the measurements to create a garment. So the first step is creating a 3D image, and then we can apply the software or the technology to electronically take the tape measure around those limbs going up. And this will be my next slide. And you can see here that we've taken it apart. And now I'm just looking at the left leg. And these are all the different measurements that we need to take to produce a thigh-high garment. We have to take both the circumference around the limb. If you've been measured for a garment, you know that. And then we have to measure from the floor up to that ring that's on the limb as well. So the software does all of this, which is super exciting, not only for you because it's a lot quicker, but also for your therapist. So if you have ever been measured, I love to use the example of being measured for like a waist-high garment. You have to take 50 different measurements. I'm sure Jeanette can talk about this as well. To do that, sometimes it can take up to 30 to 40 minutes, depending on the involvement of your lymphedema. With the vision technology that we offer through Medi, you can capture all of those measurements in about 90 seconds or less. So it's a lot quicker. So the amount of time, the energy, especially with everything going on with COVID and social distancing, we can capture all of those measurements a lot quicker. So we'll capture all those measurements, and not only will we capture the measurements within the software, but we'll actually populate it into an order form. And you can see so many different numbers that are on the screen here. This is what your clinicians or your fitters, this is the order form that they have to fill out. Believe me, they don't love doing this. So having technology that will actually do it for them is a fantastic tool. So this is a fantastic technology, not only for you as a patient, for the experience of being measured for flat neck garments, but also for your fitters or for your therapists that are using this technology. It certainly streamlines the entire process. We can also use this technology for measuring for arm sleeves as well. So you can see here, the model is putting her arm out because we have to measure around the limb, all the different measurements that go up. We do actually balance it on a tripod, so you don't have to hold your arm up the whole time. We want the experience to be fairly pleasant for you. I believe, here we go. So here's a 3D image of the arm capturing those measurements. And what I'm gonna do now is I am going to hop over. I'm gonna share a different screen and I'll actually show you. This is really cool. Here we go. So this is actually, I'm going to move it around here. So I'm going to move to the front of this scan. So this is the actual scan. So you can see I will rotate around now so that you can actually see. This is the technology that is so cool in capturing that 3D image. So you can see that she's got her hand balanced on the tripod. And then you can see all the different curvature. You can see all that definition. I can actually make this a little bit bigger. So you can see all that definition around her elbow bone going up into her armpit area. I'll go ahead and rotate her around so that you can just see how good that scan is of that limb, of that arm. Sometimes I get a little dizzy when I'm doing this. So essentially what the technology will do now is it will apply a tape measure and capture all the measurements that are required going up the limb. So that is the 3D technology that we utilize to capture the measurements to be able to create the garment. Okay, so essentially, this is MediVision. It's a new technology. Medi is the only company out that has 3D measuring for garments. There are many clinics across the country that are learning and have the technology. The technology is fantastic because we can capture the measurements quicker. We can be more consistent with the measurements. It's a fantastic opportunity to be able to get the most precise measurements to create these garments. It will capture your skin measurement along with the measurements that are made for the garment, and it will streamline the entire process to be able to get the garments. The way that it does that is that the order form, typically when a clinician or a fitter is using an order form to order a garment, they're just filling out what they think that they need to be able to get the product. That doesn't mean that we can always make it. A custom garment has a lot of capabilities to be very creative, but when you're thinking about knitting fabric, there's rows and there's columns, and there's only so many jumps that you can make to create a garment. So what's nice about utilizing the MediVision technology is that the order form that I showed you in that printout, it'll actually tell your clinician or your therapist if the product can be made. So the reason that's so important is that when you get measured for your garment, you very likely have plateaued or you've reached your baseline of your lymphedema. And what's most important is that we can deliver the product as quickly as possible to you so that you can go on your merry way and manage your lymphedema as best as possible. As we know, these garments always have to go over to Europe to be made. So if we can get all of that data collected, and it's data that we can use to produce your garment, we can get it over there and get it back to you quicker to be able to provide your solution. So Medi is super excited to have this technology here in the US. I think that we are growing every day. We're teaching new clinics and supply shops or compression stores every week for this technology. We are building it out on our website. If in fact you were looking for a clinic that offered MediVision, I believe that we recently added that onto our MediUSA website where you can look that up, or you can certainly inquire with your supply shop or your compression shop, or even with your clinician if they've heard of this technology. So we have been certainly talking about it for a while because we know digital measuring is going to be the future of compression garments. And I think it's going to be a fantastic solution to make the experience better for both you and your therapist. So with that, Jeanette, I think that was a nice intro to technology for custom garments, which we've been doing the same for such a long time.
Yeah, indeed, indeed. Christopher, I have some questions that I anticipating would be coming from the patient mind. And so I'm going to ask it. And of course, our attendees, if you have any questions, please go ahead and enter them. But thinking from the patient perspective, do you anticipate, right, because right now this is technology only available to the clinician. Correct. For their patient. So do you anticipate, I don't know, anytime soon or in the future that somehow patients can somehow have their hands on this and be able to do it themselves? Or is this going to, pretty much be, in the hands of the clinician?
I think you bring up a good point, because with the advancement of technology, everything is coming into our hands, right? I mean, our iPhones can do just about everything, these days. So I think what's most important, with custom garments is I have talked all today about capturing measurements. And that's what MediVision does. It's really good at taking measurements, but that's only part of the solution. So as a clinician, as you know, taking measurements is only one part of identifying a compression solution that will independently, manage the lymphedema for the patients. The other factors that go into this equation is selecting the right material, selecting the right options, selecting the right compression level. So what's most important is that your patient, or the participants that are on this call are teaming up with their lymphedema specialist so that they can identify a solution that's going to be as successful for them as possible. These compression garments are not cheap, and when they're made for you, it's a solution that you want to be successful. So at this point, I'm going to say the technology, I don't see the technology going directly into the patient's hands, because for custom garments, there's more than just measuring that goes into identifying a solution. And what's most important is we want your patients to get the right garments the first time.
Thank you so much. And on that note, I'm going to take a moment just to build on that. The information presented today is, not to ever replace any of the professional treatment that you would be getting from your healthcare professional, from your lymphedema therapist, from your medical team. Again, all this information is just to basically broaden your horizons, let you know what's out there for your care, and it's just so that you're more informed. So that, let's just say you go into a clinic for the first time and you see one of these technologies available, that you're not surprised, and you won't have to ask so many questions. What is that? You are already going to be armed and empowered with the knowledge of what it is. And sometimes you might even be able to teach a little something to your therapist, that you might have learned on these webinars. So again, that's just an important disclaimer. So thank you, Christopher, for making that point. I have another question. Is the MediVision able to capture like the fingers? Like you go around and it captures, can you make a glove with MediVision?
So the answer very soon will be yes. Very soon. So when we launch this for both arms, for garments that go on the arm and garments that go on the leg. So right now we're working on advanced, so you can think about measuring all these very specific measurements of the hand and also of the toes. So when you think about measuring garments, we always use centimeters. when we get down to measuring fingers and toes, just for your patients that are listening today, it actually goes down to millimeters, and that's how important and precise it is. So we will be launching the technology. You specifically asked about gloves. We will be launching that during 2021. And we're very excited because a lot of folks that have to get the flat knit sleeve also have to have that second component of getting a glove. And we want to leverage the technology to make the process easier. So the answer is yes, not yet, but yes.
I love it. Thank you. Perhaps you can debut it at the 2021 NLN conference.
Well, I'm going to beat you on that because I want to launch it before that, Jeanette.
Gotcha. All right. Another question is, excuse the New York City background noise. Another question is, for the clinicians who might be on the call, with your partnership with Lymphetech, when would they use a MediVision and when would they go to Lymphetech?
So it's two separate apps. So it utilizes the same technology, right? So Lymphetech app is it's a volumetric app, and then Medi uses their technology for the Garment app. So if a clinician who's listening is interested in one or the other, if they're interested in Lymphetech, certainly they could go to the Lymphetech website and watch different videos and find out about that technology, but also know that we have partnered up with them and we actually offer both of the apps together if their hospital was interested in purchasing or having access to both of them. So we are very much connected with them, and leveraging the technology is going to be beneficial for all the folks that are on this webinar today.
Thank you. And my last question is about the technology and also your recommendation in terms of measuring. So, like how you showed us the scan and it was so sensitive that you can even see like the indentation, right, between like the muscles, right? Mm-hmm. So let's just say that was a little bit more exaggerated. And like, let's say, you had a bulge here, it came in and it bulged back out, right? So it's a two-part question. Does the technology measure it as if you lay the tape measure flat against that contour, or does it basically fill in the blanks and it just, it's as if the tape measure was hanging across that valley of that contour?
Are you speaking of length or circumference?
Circumference. So
circumference, we will follow the contour of
You'll follow the contour.
Absolutely.
Yeah. And so do you recommend that to the clinicians also, right? Because obviously we're taking a circumference for the compression garment. So you would basically allow me just to draw this for a second. Okay. So let's say you had something like this.
Yep.
Okay. So when a clinician measures, do you suggest that they kind of pull the tape measure until it kind of collapses? Or do you lay it flat and gentle so that the tape measure hangs from here to here?
So when you're measuring for a custom garment, you almost never just lay a tape measure on. So if you've been measured for a flat knit garment before, hopefully you've noticed that your clinician actually will apply tension to the tape measure. And that tension, you sort of use the word collapse, so I'll use your same language that you use. The tension in the tape measure is very important because yes, we want the garment to give a squeeze, but utilizing the appropriate amount of tension depending on your tissue is very important so the garment will stay up. Now, I'm glad that you asked this question because everyone's tissue is very different. Some folks that have lymphedema, their tissue tends to get more firm or what we call fibrotic. Other people have more of a mixture of loose tissue that's in there. When I'm using this lovely MediVision and I'm scanning a limb, it never touches the limb. So it has no idea the makeup or the density of the tissue. So what's so important is when folks are using a technology like this, you have to know what the capabilities of it is as well. So yes, it will take measurements, But what's most important when you're measuring for a flat knit garment is that you're putting down just this camera and you're actually assessing the tissue to understand whether our software is going to work on the patient's tissue or not. Because my iPad never touched the tissue. So if you have an upper arm that's swinging in the wind because we've got a lot of loose tissue, then we're going to have to tighten that, and it has those ins and outs that you were talking about. We're going to tighten it up a lot more than maybe the technology would do. So always having hands on the tissue and doing a skin density assessment is so important. And that's why I like to say this MediVision is only a tool. It's not a solution, right? It's not a magic wand. It's not press a button. It's going to tell you exactly what fits and what you should get. It's a tool that folks that can use to be more accurate and be more efficient.
Thank you so much. We have a question. Is the technology available in Canada? And if not, will it be available anytime soon?
Absolutely. I have been on many conference calls with Medi Canada, and they are going through a project right now to bring it on board. So yes, it's coming to Canada.
Thank you. And I believe those are all the questions. Christopher, thank you so much for your time. And thank you so much for your amazing support of the NLN.
Fantastic. Thank you. Thanks for the opportunity. And I hope everyone's getting some great information.
Thank you so much. Thank you both to Medi, who is our magenta sponsor, and InBody, who is our silver sponsor. And we couldn't do it without you, without your support. And I'd like to take a moment to also acknowledge another significant donor who I believe is actually on this call. Her name is Lynn Beard. Thank you so much for your significant donation. We are so grateful. And for all of our donors, we're so appreciative of the support that you give us and ask for nothing in return. Now it is my pleasure to play a video for ImpediMed. They were not able to join us live today, but we do have the ability to ask any questions to them via their email, which is info@impedimed.com. So Christy, if you'd be so kind as to put that into the chat for our attendees, and allow me just to share their video. And here we go.
I'm Patty Galloway with ImpediMed, the manufacturer of the SOZO device, the first and only FDA-cleared bioimpedance spectroscopy technology to aid in the assessment of lymphedema. ImpediMed is the world leader in the design and manufacturing of solutions that employ bioimpedance spectroscopy, or BIS, for use in the clinical assessment and monitoring of fluid status and tissue composition. Our goal is to develop solutions for clinicians to better understand what is going on inside the body and use that data to improve the patient's course of treatment to impact a positive outcome. I will be joined momentarily by Christy Green, our Director of Clinical Implementation, to demonstrate the technology. As you all know, lymphedema is a lifelong risk for cancer patients who have had lymph nodes removed and other risks such as chemo, radiation, and elevated BMI. Here are some eye-opening statistics regarding cancer-related lymphedema. There are 17 million cancer survivors in the United States. 1.8 million new cancer patients are diagnosed every year in the United States. 975,000 of these new cancer patients are at risk for lymphedema. 1 in 3 will develop lymphedema. 1 in 3. We do not have a crystal ball to tell us who that one will be, so it's important to have a device that can help clinicians detect lymphedema subclinically before symptoms appear. Lymphedema is the leading post-surgical complication for many cancer patients, and it's the most feared consequence of cancer survivorship. What kind of price can you put on that? Well, studies have put a price of $7 billion annually to healthcare. The opportunity for detecting lymphedema is before patients experience symptoms. Typically what happens is the patient experiences swelling, they pick up the telephone and call their doctor. She refers the patient to rehab. Patient gets an appointment in a week or two, and guess what? It's too late to reverse the lymphedema. We know from data collected when following a lymphedema prevention program utilizing SOZO technology that you will be able to aid in the assessment of lymphedema subclinically in a higher number of patients where you can detect and intervene before symptoms occur. The green area on the chart is where you want to be able to intervene. So when do patients develop lymphedema? The first 3 years. It is critical to have a program in place to detect and intervene, especially those first 3 years. Notice the incidence of developing lymphedema on the graph. It doesn't just drop off, it flattens out, but it doesn't go away completely. Lymphedema is a lifelong risk and requires the clinician and patient to continually monitor and treat. The good news now, lymphedema is preventable. Based on evidence from the PREVENT trial, which most clinicians are familiar with, the study showed a 95% reduction in the progression of lymphedema in those whose lymphedema was detected and treated subclinically. Here is more in-depth information on the PREVENT trial. There were 1,100 patients. It was a randomized controlled study. There were 10 centers, including Vanderbilt, MD Anderson, Mayo Clinic, and the University of Kansas. Again, the study showed a 95% decrease in the progression of lymphedema by utilizing LDEX and following a test, trigger, treat type of protocol. These are 6 cooperating, single-center, real-world studies. They revealed similar results to that of the PREVENT trial. You might be familiar with Pat Whitworth, Nashville Press Center, or Sabrina Koren-Tager at KU. What is this lymphedema prevention program we keep talking about? It is a comprehensive program that includes all cancer patients, men and women, who have breast cancer, melanoma, pelvic area cancers, as well as patients having the following treatments putting them at risk for lymphedema: axe dissection, sentinel node biopsy, mastectomy, radiation, and chemotherapy. Lymphedema prevention is as easy as test, trigger, treat. The test portion is done with the SOZO device. SOZO is the Greek word for healing. SOZO is the first and only FDA-cleared BIS technology to aid in the assessment of lymphedema. It's a 30-second routine measurement. It's like taking a vital, and it tags onto existing visits. You can place it right next to your scale. SOZO gives you an LDEX score or a lymphedema index score. LDEX is comparing a healthy limb to an at-risk limb. LDEX is built into the SOZO device. If your patient's LDEX score increases by 6.5 or greater over their baseline score, that could indicate subclinical lymphedema. That triggers you to intervene. Intervention includes treating with at-home compression. Christy Green will now join us to demonstrate the SOZO.
Thanks, Patty. I will now walk you through taking a measurement with SOZO. On your screen, you see the SOZO device on the left and the tablet image on the right. As you can see, the SOZO device has a small footprint. To take a measurement, select the patient from the list, press measure, enter in the patient's weight, and hit start. The measurement takes about 30 seconds and can detect changes in fluid as small as 2.4 tablespoons. As Patty mentioned, most people place it next to their scale to be used when doing other vitals on the patient. Once the measurement is complete, the results are automatically displayed. You can see today's LDEX results and the trending of the patient immediately on the tablet or on the computer via mysozo.com. With the 30-second measurement, you can also see tissue and fluid outputs. These outputs, such as fat mass, fat-free mass, skeletal muscle mass, can help see if a patient is losing lean, healthy tissue that is needed to help fight disease. This is a case study to share an example of how test, trigger, and treat work in clinical practice. In this example, the LDEX score pre-treatment was negative 2.1. 3 months after surgery, the patient's LDEX score was 1.1. But then 6 months after surgery, the patient triggered with an LDEX of 13.8. So treatment was initiated, and then 4 weeks later, the LDEX score returned to normal. You would want to continue to test, but the patient would not need to continue treatment unless they triggered again. Treatment can be as easy as at-home compression for 4 weeks.
Thank you again, Christy. This is a typical workflow for the lymphedema prevention program. Using the test, trigger, treat protocol, a baseline measurement is taken, then the patient will be measured quarterly for the first 3 years, every 6 months, the following 2 years, and then annually going forward. Another great feature of the lymphedema prevention program allows nursing or therapy to use LDEX scores as part of their decision-making to initiate therapy. As you can see, it's an easy workflow. LDEX technology is already recommended in several clinical practice guidelines, including APTA, where BIS is recommended to aid in the detection of lymphatic transport impairments and can be used as a tool in the diagnosis of subclinical and early stage lymphedema in patients. Another essential aspect of the program is patient education. Educating patients is so key. Patient compliance makes for a successful program, and knowledge empowers patients to drive compliance. Tools to make you and your program successful include press releases, promoting your lymphedema prevention program on your website, educational programs, and patient brochures to educate. We know that you are passionate about the survivorship journey and quality of life of your patients, and a program like the lymphedema prevention program will provide better outcomes. Imagine providing a prevention program versus a treatment program. So the question to ask now isn't, why should we start a lymphedema prevention program? But why haven't we provided a prevention program that will allow consistent early detection of fluid imbalance and potentially reduce lymphedema progression by 95%, that seamlessly integrates into our existing workflows, that allows nursing and therapy to assess and initiate treatment, that improves patient care, patient outcomes, and the survivorship journey, and that will attract and educate new patients and reduces costs associated with lymphedema treatment. Thank you very much. If you would like more information on the lymphedema prevention program, please go to www.preventlymphedema.com.
And with that, we'd like to thank ImpediMed for their bronze sponsorship support and for creating that video for us. So thank you to all of our sponsors today. We're, are forever grateful for what you do for us and in enabling us to do what we do. And I'd like to thank my team once again for sticking with me every single day this month. I think everybody kind of thought we were a little crazy to do this every day in March, but we truly hope that everybody is enjoying all the educational content that we're putting out there for you. And so to end, we are going to do our drawing. And Christy, I believe that you have the wheel of names. So if you'd be so kind as to share your screen. And whenever you're ready, hit the select button 3 times. It's a beautiful evening here in New York City. I hope it's just as nice wherever you may be. It's 82 degrees in Texas, where Veronica Sanurias is. I don't know what the temperature is here in New York, but it's beautiful. I'm not going to complain no matter what the number is. And there she is. All right, Christy. So if you can just go ahead and share your screen.
It will not let me share my screen. I don't know why, but it
Oh.
will not let me share my screen. But I did click on it, and the winner was Lynn Fast.
Okay, Lynn Foss is our first winner. Excellent. And then our second winner.
Is Peta Miclem.
Peta, you are our second winner. Congratulations. And one more.
And our third winner is Chris Hauser.
Is Chris
Hauser.
Chris Hauser. All right. So Chris, Lynn, and oh, forgive me now. Who was the second one? Chris, Lynn, and oh, Peta or Peta, forgive me. If you can please email Christy Blair. She's going to put her email into the chat right now for you. And if for some reason you're not able to connect as we're starting to wrap up our webinar, feel free to contact me. It was my email, which was connected to the webinar information. If you have any if you had any questions. But thank you so much to everyone for staying with us. You have so many other choices in terms of what you could be doing on your Friday evening, and you chose to spend it with us, and we're so grateful for your time and engagement and your attention, and I hope you have a wonderful weekend. And for those of you who will be joining us tomorrow, we'll see you tomorrow. Take care. Bye-bye now.